Join me, Charlotte Stallworth, Vice President of Business Development and Innovation at Stanford Medicine Children's Health, as we engage the brilliant minds driving change in healthcare, unraveling the mystery behind the next medical innovation. So today we're going to focus on innovations in mental health, and according to the National Center for Chronic Disease Prevention and Health Promotion, mental health includes our emotional, psychological, and social well-being. It affects how we think and feel, and also helps determine how we handle stress and relate to others and make healthy decisions. I am really pleased to welcome Dr. Eric Kuhn, a clinical psychologist and associate professor of psychiatry and behavioral sciences at Stanford University School of Medicine. He is the co-chair of the Stanford Mental Health Technology and Innovation Hub. His research concentrates on leveraging web and mobile technology to enhance access, initiation, and engagement in PTSD, post-traumatic stress disorder, and related mental health care, aiming for patient-centered, efficient, and effective solutions. Dr. Kuhn, welcome. So happy to have you here today.
Thank you for inviting me. I'm looking forward to the discussion.
So how did you first recognize the need for high-efficiency mobile apps in the mental health space?
Yeah, so I've had this long-standing interest in how we can get our effective interventions out to the populations in need who don't have access. And so, in the 1970s, there was a whole move to kind of give away our psychological interventions. There's bibliotherapy, the books were out there, and really that ethos of, we're developing this really good stuff that can be helpful to the population, but we don't want to limit its access. So how do we get it out there? So back in the day, it was about books, right? And getting it out there with self-help books. And there was a whole movement on just giving away our technologies, our innovations in this space. And so when I was in graduate school, I was working in a lab where we were working with motor vehicle accident trauma survivors. And what struck me was that they would be admitted to the hospital with an injury, and there would be no psychological kind of help, nothing for them. And then they would be released. And then lo and behold, a certain percentage of them would show up, a few years later with post-traumatic stress disorder from these horrific accidents. And so it just struck me that we need to get to where these people are, and there isn't enough resources in these settings. So in a typical emergency department or a hospital, there might be one social worker whose kind of collateral role is to kind of work with these trauma survivors. And so it really struck me that we could get in that space. We could do something early on to maybe prevent PTSD or that, acute stress from becoming chronic PTSD. And so really this long-standing interest led me to start working on internet-based interventions. So using the internet and knowing that these folks are in the hospital, they're kind of staring at the wall or the same three channels, on the black and white TV. How do we get them the interventions right there in the hospital room? And so really with a laptop and with an early intervention like that, that's what I was envisioning. And so we started developing early intervention website for trauma survivors, not only these hospitalized trauma survivors, but other trauma survivors, recent rape trauma survivors, others, and using the internet to do that. In early 2009, we started seeing our veterans in our men's trauma recovery program, especially the younger veterans, coming in with smartphones. And so, I think 2007-ish was when the iPhone came out, right? And so the younger veterans were showing up, and they were kind of in that space, right? They were in there and they were playing on their smartphones, especially like in groups and stuff, they were there on the smartphones. And so we realized that maybe this internet-based strategy that we had been engaged in, maybe that wasn't really the path, especially since we had been building things like these programs that were elaborate, that had like multiple sessions, almost like mirroring what psychotherapy looked like. And what we realized pretty early on is like people don't use the internet like that. And so, but with the smartphones, we thought, wow, this is potentially a whole new area that's going to come in. So we started kind of thinking about how we might build an app. And we were fortunate to get some end of fiscal year money in VA to put toward building what ultimately became our PTSD coach mobile app. And so that to me was kind of like the turning point. I think we didn't know a lot about how smartphones were going to be used, but we did know that they were being used, and we needed to be where the veterans were, and that was in this new environment, especially with, I think, the transition from Web 1.0 to Web 2.0, where there was a lot more interaction going on the internet. So, yeah, that's when it kind of came into high relief that we needed to get into that space.
That's amazing. The work that you're doing and the population you're concentrating on, and also innovating on your innovation. So going from seeing that the books in the marketplace maybe weren't the best thing to use, going to the internet, but then quickly adjusting to where your patients are and where your audience is, and really going to smartphone-based apps is very exciting. I'm sure very effective as well. Can you share some of the key principles or strategies you implemented to ensure the effectiveness of your mental health apps?
Yeah. So, even when we were kind of working on the internet-based interventions, the key kind of principle that we had was that we needed to go to the evidence base first. So what is the evidence base telling us about what the most effective interventions are? So we kind of had that as our kind of guiding post, like that's the direction we're going to go. We're going to always go to the evidence first, evidence-based medicine, evidence-based psychotherapies, go there and see what's available. And so we also, once we identified kind of the best, most effective interventions, then we invited the original treatment developers as subject matter experts. So, in VA, we have cognitive processing therapy for PTSD. We have prolonged exposure therapy for PTSD. These are the evidence-based treatments that the VA has been rolling out since 2007. So that having clinicians trained in these, making sure veterans have the most effective interventions for PTSD. And so we brought in the experts from the University of Pennsylvania, the Emory University, from the National Center for PTSD in Boston. So Patty Rezick and Barbara Rothbaum, these treatment developers who had kind of created the whole evidence base, or a lot of the evidence base for these treatments, and were actually involved in the training in VA. And so we always engage the top of the line kind of subject matter experts. We also use a user-centered kind of participatory design strategy, so that we make sure that the end users are centered kind of in the room with us as we're developing these apps, and we have robust kind of loops of feedback that we get from the end users. And so that's a strategy that we make sure that we employ to make sure that we're developing these effective interventions. And then I think the engagement piece of it. So we really need to make sure that we have engaging, kind of user-friendly, apps that folks are going to benefit from. And so we have a design firm that we work with, as well as in-house expertise at this point, to understand what are the best practices in user experience, and making sure that those are incorporated. And again, making sure that we're getting end user input throughout the process, and then really making sure that we're getting the end users to engage in the effective ingredients of the apps. So not just kind of going in and playing around, but actually doing the things in the app that we think are going to be the most helpful for them based on the evidence that we have. And then the last thing, which is probably the most important thing, is that we need to go and test and validate, right? We need to know that you can take something like a psychotherapy, put it into an app, right? Or some of the ingredients, some of the components, but is it actually that translation? Is it going to show efficacy, and are folks going to actually benefit from it? And so that's kind of I think the kind of the pillars, of our mobile apps program, and how we go about making sure, or trying to get the best shot possible that we're going to actually develop effective mental health apps.
That's impressive. Really taking the evidence-based approach, but also the approaches of human-centered design when you're adapting those to the apps and involving the end user early and often as the apps are being developed. And then a really great point on the testing and ensuring that what you've envisioned and conceived actually works. I'm going to switch gears a little bit. So as co-chair of the Stanford Mental Health Technology and Innovation Hub, how do you see academic institutions contributing to some of the ongoing advancement and integration of technology in the mental health care space?
Yeah, so I'm just so privileged. I think we're all so privileged to be working in an academic medical centers as we do, and it just just the mix of incredibly smart people, including the students and trainees that we get to interact with. But we also have world-class clinicians who are constantly seeking to improve practice, so they're really not satisfied with the status quo. They know where things are working and not working, and so they are open to innovation. And in our department, there's lots of folks who are doing really cool, innovative things in their clinics. Same thing in VA. Lots of folks bring in innovative practices. And so I think that along with kind of the system, we work in a system that really supports kind of things like measurement-based care. There's a strong academic mission of the mix of science and practice and teaching. And so I do think we are in a place that has all of the right ingredients to kind of to advance the field in a way that other places maybe don't have that. But it's Stanford, right? We're in the heart of the Silicon Valley. We get to interface with industry as well, which is really cool, and the advancements that are going outside of our area. And so what's cool about the Tech Hub is that we bring together folks in the department, folks outside of the department, folks outside of Stanford, and we have that really cool kind of mix to kind of understand what is happening not only in our ecosystem, but in the broader ecosystem so that we stay up to speed. So it's been a really exciting place to be able to do all of this. And to me, it's like, I always say it's like drinking out of a fire hose, right? It's just so much. There's cool stuff going on. It's hard to keep up with it all. It's hard to understand it all. It's hard to even manage all of the knowledge that's coming in all of the time. But I think that that's really what energizes me, is like it challenges and energizes me to try to kind of keep up. And it's just an exciting time, I think, with technology and what's happening and the potential of technology to solve long-standing, chronic, what seemed like intractable problems in healthcare. Hopeful that we, with technology, can actually start developing solutions that are and we are developing solutions that are gonna actually make a real meaningful impact.
I agree with that. And working across Stanford Medicine, and really, for the last year, I've been like trying to identify the innovation hubs at Stanford, and there's so many, and they're ever changing and growing. And I agree, it definitely contributes to that culture of innovation and finding new things and collaboration really across disciplines, across fields, and creating technologies of value to society. And in the mental health space, I think in both pediatric and adult, there is a growing demand and need for technologies and interventions to help maintain positive and healthy, mental status for the population. So the work you're doing, but also bringing in others to talk about things, I think really helps to advance the technology that we can bring to people, not just incremental advancements, but really like groundbreaking leaps in healthcare. So really appreciate that. And I think we're definitely all in on supporting it. Can you tell us like in what ways the user experiences design play is a crucial, excuse me. In what ways does user experience design play a crucial role in the success of mental health apps, and how would you prioritize that in your projects?
Yeah, and this is so fundamental, right? It's just so fundamental. Like, to be able to build something that's going to actually move the needle and help folks, you need to understand what their needs are. You need to kind of use a design thinking kind of approach where you would go in and find out what their needs are. You need to kind of really figure out what the problem is. All too often, I see folks coming, with solutions, and they're beautiful, elegant, lovely solutions, right? And we think about like our tech like as, oh, this is a solution, this is a solution to, but it's oftentimes they're solutions looking for problems.
Yes.
And so I think it's super important to start with understanding what the users need, what their issues are, really empathizing with them, and then really clearly defining the problem that you're going to try to develop a solution for. So right from the very beginning, when we started in the mobile app space, we went to the men's trauma recovery program and we did focus groups. So, and we had to kind of be humble, I think, about this, right? Because we had our ideas, clinical psychologists building, internet-based interventions. We know what we're doing, and we know what you want. But we went in and we said to them, here's what we're thinking about doing. We're going to build this mobile app. It's going to have a way that you can challenge your cognitions and you can engage in these behavioral kind of things, and you can do this and that. And they kind of pushed back, which is great about veterans, is they're going to speak their mind and let you know how they feel and what the issues are. And so they told us that they wanted a solution for when they're kind of out and about in the real world and they're feeling stressed, and they're triggered, their PTSD is triggered, and they want to kind of stay in the moment. They don't want to, leave their spouse on the line at Costco. They want to be with them, and they want solutions that could be helpful in that moment. And so we kind of went back to the drawing board and we said, instead of trying to develop what would look like we're packaging psychotherapy into an app, we said, let's just open it up. We're just going to have like nice tools and skills and some psychoeducation, some ways they can monitor themselves to see how they're doing over time, some plays with some supportive kind of material that they could use to find additional care if they need it. But we're not going to try to do everything in this app. What they want and what a mobile app and a smartphone is something that's portable. It's out and about with you in the environment. So that really made sense. And so we went back to the drawing board and kind of developed the PTSD Coach app. And then we brought it back to the same end users, a new population, a new sample, because they were patients in this program, and the program is 60 to 90 days. So it took us a little longer than that to build the app. So we went back into the program and we got their reactions to what it was that we built. And it was really super favorable. They really appreciated it. And I think it validated that approach. So what we do now is, all along the way, we're always collecting feedback. And it could be feedback as simple as things like going in and reading the App Store reviews and finding out what's going on. It's things like having a dedicated email address. So all of our apps, you could just go ahead and send your feedback. It's also including in some user experience or some evaluation into the apps themselves, where they can go ahead and complete a little survey if they want to provide feedback. It's things like bringing in veterans into the lab or into the virtual lab and interfacing with them and getting their feedback. But it's, the idea that, software is never done, right? So you can always keep iterating. It's not like what I said at the beginning, where we publish a big, thick book and, we put it out there and it's going to take 10 years before the second edition comes out. We can iterate, we can constantly kind of take that feedback and we can make the improvements that are needed. And then in all of the research that we do, we include both quantitative, kind of like, are we actually seeing any kind of changes on the outcomes that are of interest? But we also get that qualitative user experience feedback, where we'll sit down with the participants and find out in depth, how they use the app, what they liked about the app, what kind of improvements they would like to see on the app. And so we take it all in and we can kind of crunch it. And then we use that to kind of, as we're going to a new version, if it's feasible, and we can do it, we try to include their feedback and update the app with that. So it's so crucial, to making sure that the app is going to be received favorably and potentially can be helpful for the end user, and it's solving a problem that they have, not a problem that we think needs to be solved.
I appreciate that approach, and I agree. Being here in Silicon Valley, you do see a lot of solutions kind of in search of a problem, and it's important to always be closely aligned with the people you're trying to help and understanding even their changing needs and adapting to that. I definitely appreciate that. With innovation across Stanford Medicine and of course across the country, there's a big focus on diversity and inclusion, especially healthcare, health equity, and ensuring that innovations are decreasing the inequities versus focusing on those who have the technologies or a key group in some kind of way. So definitely appreciate your focus on veterans who sometimes are, not getting all of the attention they need, especially with mental health needs. How else do you think some of your technologies and other technologies you see can help address maybe health inequities?
Mm-hmm. Yeah, so what's really cool, and definitely totally agree, we need to kind of be thinking about our full population, right? Not just parts of the privileged population and the folks who have, access to certain things. And so, what's been really cool about smartphones is that we know that uptake of smartphones isn't dependent on socioeconomic kind of or ethnicity or race issues. So it seems like we get good kind of equity or equality across like the uptake. So that's pretty cool that we're going to be able to reach people. And then when we reach them, we want to make sure that the tools are appropriate, culturally appropriate, they've been adapted, and that we get the end users from the groups that we're trying to make sure we are represented and can use these technologies, that they are also included. So that's a component of our program, of our development program, to include diversity of all different kinds. So, for example, we have in our apps things like, go for a walk, or go to Starbucks, or, or go to the coffee shop, and like we have to be careful even of that. Like, we're making assumptions, right, where people are living, they might be living in a place where maybe it's not safe. And we have veterans who are in places where, we have to be careful that, that we're not telling them or, suggesting that they do certain things. Because they're in places where those things might not be available, even like in rural settings. Lots of veterans live in rural areas, so there's a rural culture as well. We've found out from research that, even trying to get smartphones out to some of the folks in rural cultures, that they maybe don't even want to be on a smartphone. So like, we have to be careful with those assumptions as well. They go to the rural places because they want to have a more maybe simple, they don't want to be on the anthill of the peninsula out here in Silicon Valley. They want to be out in the foothills of the Sierras, and they want to, be more with nature and not on a device. So it's just all of that all of those considerations that we want to make sure that we're building products for folks across the full spectrum of whatever dimensions of diversity that we're considering. So it is a challenge, right? It's always a challenge because there are so many dimensions, but I think that challenge is something that we look forward to and we work on, and that we bring in folks who can help us figure that out, because we can't do it alone.
I appreciate that. In my work with innovators from within Stanford and outside Stanford, I see solutions for various segments of a problem, right? And of course, those innovators don't know one another, or maybe they're all a lot of them are working on the same problem. So you see a lot of solutions that are kind of divided approaches. And, from my perspective, thinking from the healthcare system, and maybe even as an individual who may have a couple of different issues going on, it seems that it would be great to have a kind of one-stop shop for certain, like maybe mental health needs, for maybe certain other needs to manage certain conditions. But of course, that is not feasible given how innovation works. So how do you think we as a leader in innovation in a particular space, how do we look at that? Do we lean more toward trying to have a one stop shop, or is it better to take the best, most perfect solution for this segment of a problem? What do you think?
Yeah, that's a great question. And so I think that it would be ideal if we had a one-stop shop, and it would be great, and maybe one day it would be feasible. We are kind of on the edge of the transformation or the revolution that AI is going to be marshaling in. So we need to I think we need to get to a place like that where folks could come in, but in VA we think about like multiple doors and windows, and no kind of entrance is the wrong entrance. So I think with this it's the same thing. We want to get to a place like that, and with our apps, they are contained kind of. And if you think about an app, you go into your Maps app, you go into, like, each of the apps has a unique purpose, right? But there needs to be some kind of coordination, right? Of, hey, there's an app for this, why don't we start working on this? And so that's often the provider's job. And so we have things like in VA, in primary care, we have providers who will kind of have a suite, the suite of apps. We have a little prescription pad. They can check off different apps to use. And so it's kind of like a one-stop shop. Here's some apps you can use, and we'll check in and see how you're doing with those apps. At Stanford, we have a psychiatrist, Sarah Johansson, who is working on a digital clinic. So where they would work with the provider to bring these digital tools in, and with different levels of support depending on the severity of the patient's problem. So, there's also, the burden on the patient to be coming into treatment, right? You
Right.
got to find childcare, you got to go after work, it's every week. And if you have that, and so this can actually help to reduce the burden on the patient. So yeah, I think, one day it'll be great to have a one-stop shop. Right now, it's kind of, using apps as needed for different things as we do. We have a whole bunch of apps on our phone, right, for each of the particular purposes that they're there for. But I do think having that coordination, because we're working with a person, right, who has,
Right.
different needs. And so helping them to kind of pull that together is definitely a direction that I think, either clinicians or artificial, intelligence at some point will help to kind of pull that all together.
I agree. That's a great point on the role of AI in healthcare and the future role. I think I feel like sometimes we're in the future now, but also very, very close to something very different with AI. So I think that is exciting all of us. As we move more of our healthcare to apps and kind of a digital space, there is the concern for privacy and security, and probably in healthcare, that concern is the greatest among all disciplines. So what concerns and do you have there, and how do you address those when you're developing your apps and putting them out there for use by the veterans and other people?
Yeah, it's definitely, if you see what's happening with industry, with folks out there with, different platforms, um, even if they say, your data is going to be secure and protected, and you find out that they're actually selling your data, things that are free or not free, they're making money somehow. And so you want to question how they're doing that. It's interesting because, um, you know, uh, it feels like folks are not as sensitive to that as maybe they should be, about having their data kind of go off into the ether, and kind of, where is it going? Who has my data? I think in mental health, we have to be particularly kind of careful about that. So what's great about VA, and there's a trade-off. So what's great about it is that, from the very beginning, we designed our apps to be self-contained. So there's no data, no personally identifying data going anywhere. It's not being sold, to advertisers. It's not going off to, third parties. It's all on the app, and the user gets to decide what they want to do with their data. So, that's a bit of a trade-off because we don't get the individually identifiable data. But what we do have is the ability to kind of get anonymous data from the downloads so that we can do things for the business purposes in terms of being able to kind of find out how folks are using the apps, what kind of things in the apps are not being used, what kind of improvements we might want to make. And then we have other ways in research to be able to actually kind of look at these data as well. So that's been really cool. But veterans from the very beginning, I talked about those focus groups we did for PTSD coach. They told us they did not want to be tracked, right? That they didn't want to be tracked, that there was some concerns about, the government tracking them and knowing where they are and having all of this data on them. And so we were really aware of that kind of concern and that it would limit the use and the impact of our apps if we were going to try to capture that data. What's interesting is there seemed to have been a secular trend when I brought the app back to the veterans. They were like, oh, it'd be really cool if I knew where other veterans are, or if I could figure, it would tell me where the local hospital was. So kind of like tracking, but anyway, with our apps, we are often kind of held out as kind of like the way to do it, which is that there's no data going anywhere. We have the luxury of doing that because we're building apps with public money, right? We're not in a space that we need to kind of monetize things. So yeah, it's just that we have to be very, very careful. I think you're right that we want to make sure that we're not taking this lightly. And so the security in our apps, you'll see how we protect the data. There's a clear kind of a security statement and confidentiality statement right in the app itself so that end users know what they're getting into when they download and start using that app.
That's wonderful. I'm sure that gives a level of comfort in moving forward with the app and being maybe fully engaged, knowing that there are no risks to their privacy, at least, with information going out into the internet and other places. So thank you so much, Eric, for being my guest today. I'm sure our audience has learned a lot about mental health tech development and the importance of that human-centered design and having your end users involved and being evidence-based as well. Really appreciate your work in this area. You're sharing your expertise with us today. Thank you so much.
Yeah, thank you. It was my pleasure.